If you're over 50, we want you to know which steps you can take to maximise your chances of enjoying great vision for the rest of your life. Macular degeneration hits 2% of the population over 50 and a staggering 28% of those over 80. This is a serious, blinding disease, and we don't want you to suffer from it. At ICU, we want you to keep your eyes as healthy as possible, and we want you to benefit from all the research that's been done regarding macular degeneration. We want you to enjoy all the visual things that matter for a long time to come. Things like driving, reading, recognising faces, even seeing your meals. So just what is macular degeneration? The macula is the central part of your retina. The retina, seen here in orange, is a layer that covers the inside of the back of your eye. It's the retina that receives the light from the world around us and converts it into the moving picture of what we see. Here's how it works. This is a diagram of light being focused from the outside world onto the retina. This is a close-up image of a real retina, seen with an instrument called an OCT, or optical coherence tomographer. It's like an ultrasound for eyes. Focused light travels to the retina, fights its way through a layer of fibres, then it's converted into electricity by the retinal cells. The cells then bounce that signal backwards into the layer of fibres. Each fibre now carries that tiny electrical signal to the optic nerve and onto the brain. Multiply that by millions of cells across the retina, thousands of times every second, and that's how we get the moving picture of the world around us. Across most of the retina, the fact that incoming light has to fight its way through a layer of fibres means that the signal quality is slightly diminished by the time it hits the light-detecting cells. There's one place this doesn't happen, and that's right where your central vision occurs. That's the macula. At the macula, nature does us all a big favour and shoves the fibres out of the way. Light from what we look directly at gets straight to the macular cells, so the quality is much better than elsewhere in the retina. That's just one reason the macula is responsible for most of what we pay attention to with our vision. Put simply, we use our central macular vision for everything we want to see well. With all that work going on, converting light into electrical signals thousands of times every second, the retina needs a ready supply of nutrients and oxygen to work properly. That supply comes from a rich network of tiny blood vessels just behind the retina. It's the function of these vessels to supply nutrition to the hard-working retinal cells. They do it through a filter called the retinal pigment epithelium, or RPE. The function of the RPE is complex, but in a nutshell, a healthy RPE keeps the retinal cells safe from damage. This is the earliest beginnings of what can progress to macular degeneration. It's called a drusen, and when there are more than one, we call them drusen. Drusen aren't fully understood, but essentially they can disrupt the protective function of the RPE, allowing retinal cells to become damaged. Damage can then lead to scarring, and the scarring means those cells don't work anymore. If a person has enough scarring at their macula, the vision can be like wearing glasses made out of bubble wrap, where some bits work and some bits don't. Eventually these can all join together, and central vision is then just gone. That's the nuts and bolts of macular degeneration. In retinal photographs, we can see drusen when they're big enough. When the disease is very early, however, we need an OCT scan to see these. An OCT scan allows us to see the retina in cross-section, layer by layer. Early drusen look like this and won't necessarily show up on a retinal camera. If you're over 50, we will scan you routinely for the earliest signs of what can become macular degeneration. Knowledge is power. If you know you're at risk of developing a devastating eye disease, you're much more motivated to take steps to stop it. We've been watching maculas very carefully for many years, and we've seen whose maculas stay healthy and whose don't. From what we see in our patients, the single biggest common denominator for those who keep healthy maculas is that they have daily exercise in their lives. This can be simple as going for a walk for half an hour each day. The key is, it must be cardiovascular exercise. You need to get your heart rate up. That's not always easy, especially if you're over 80. And if it's a challenge for you, we encourage you to discuss how you can do this safely and effectively with the experts who know. They include your GP, exercise physiologists and physiotherapists, and personal trainers. Diet is vital too. Leaning towards a Mediterranean diet provides your system with all sorts of nutrients to help prevent macular degeneration. This would include lots of green leafy veggies, lots of salads, olive oil, fish or fish oil, and citrus fruits. Steering away from excessive sugar and erring towards lots more fibre are also really good strategies. Cigarette smoking makes you 6 times more likely to develop macular degeneration. We recommend that if you're having trouble quitting, talk to your doctor about finding the best way to give up forever. Exposure to UV has been implicated in macular disease. Make sure you wear your sunglasses as much as you can when outdoors in daylight hours. Your clear prescription glasses may already have a UV filter. We use our OCT scanner routinely for patients over 50 to screen for macular degeneration. The usual charge for this is $80. And because we insist that you have it done, we also invite you to ask us to make it free of charge if that's something that doesn't fit in your household budget. If you'd like to know more about macular degeneration, email Julie at this address or visit the Macular Disease Foundation website. If you'd like to know what your macula looks like, make a time to visit Andrew Robinson or Julie Newport for an eye test. You'll be glad you did. You can book online from our website or just give us a call on 3368 3644.